Hi, everyone. My name is Michael Hawkins, and this is the debate model for care versus habilitation. This will be an informal debate consisting of myself, who will act as the introducer and fielder. We also have Kira Tollison, who will serve as the summarizer, researcher, and illustrator for the habilitation side of the debate. And we also have Megan Jones, who will also be our summarizer, researcher, and illustrator, but she will argue for the side of care services. Oftentimes, we come to a point in services where care and empowerment butt heads, so to speak. And we ask ourselves, as well as our supporting professionals, which route should we take to achieve the best results possible? What is in the best interest of our client? And is there a middle ground between care and rehabilitation? So our presentation will outline the advantages and disadvantages of both sides to ensure that we are equipped to making the best decision possible in regards to our clients and their well-being. So with that being said, now Kira will summarize and discuss the research we've collected for empowerment.
Thanks, Michael. Before we begin, I would like to point out the differences between the terms empowerment and habilitation, as we'll be using them interchangeably throughout the debate. While they're similar and relate to each other, there are some notable differences between them. Empowerment involves giving power or control to individuals or groups that have traditionally been marginalized or had control of their own lives limited or surrendered. Habilitation, on the other hand, refers to the process of empowering individuals by helping them gain, maintain, or improve upon their daily living skills. This can occur at any point in an individual's life, but is centered around teaching skills that have not yet been gained or mastered. It's important to focus on one's quality of life and how it may be impacted before deciding whether to place an individual in a care or a habilitation program. While it's fairly apparent that care programs are more likely to be successful when it comes to individuals with moderate to severe disabilities and the elderly, since many of them are unable to participate in daily living skills due to more debilitating conditions, habilitation programs are likely a better option for those with mild disabilities and those in other populations, such as neurotypical children and teens that weren't taught these skills by their parents, homeless individuals, women escaping abusive relationships, and veterans. Many people in these demographics lack skills that would allow them to have a high quality of life, anything from basic hygiene, employment, money management, safety, and relationship skills. Habilitation programs are able to address these skills and help these individuals improve upon them. This graphic shows how vocational habilitation may be used to teach employment skills to those that may lack them so that they may be more successful in gaining and maintaining employment. These programs focus on anything from teaching personal hygiene expectations at work to providing people with volunteer and other opportunities to increase their work experiences so that they may be able to compete more effectively in the job market. It is best to place individuals in programs that will allow them to improve upon and later maintain a higher quality of life. Habilitation programs will allow many individuals to do just that, since they work to teach skills and allow individuals to be more independent, instead of having someone there to complete tasks for them, which is likely to happen within a care facility. Having worked in a care facility for several years now, I know from experience that while we attempt to implement programs that will teach individuals these skills, they know that they have staff around that will complete the tasks for them if they refuse, because it's our job to do so. This causes these individuals to become dependent on their staff and will make it difficult to transition out of services later if they and their families decide this is the best decision for them.
You're muted, Megan.
All right. Thanks, Kira. You provided a lot of good points regarding habilitation and the quality of life for individuals with disabilities. But one point I do want to touch on is the notion of individuals in these programs becoming dependent upon the staff. Oftentimes, family feels as though they can provide a better quality of life for the individuals because they feel like they know them better. This, of course, has a great deal to do with the quality of life among the family as well in the community that supports them. Habilitation programs usually focus solely on the individual's well-being without a thought of the well-being of the families that they're connected to and the way that that person will be perceived in the world, and this can impact the success of the individual. Hartley et al. Showed in a 2010 article that mothers of disabled children who were less educated and had their child at a young age had higher rates for divorce. And this was due partly because of the increase of the burden for caring for the child's needs and also the inability to adhere to the spouse's needs. The data showed that the decline in remaining married began in the child's early childhood and remained at a high rate all the way until the child's early adult life. And this was certainly a prolonged period of vulnerability for the marriages, dealing with lasting behavior concerns and the overall effects of the child's quality of life as well as the family. In a 2017 article on the comparisons of parenting styles between ASD, anxiety, and typically developing children, it did show that there was no significant difference in the parenting styles of these parents. And this, of course, was on the level of like love and support. So caring for the child's needs was not something that hindered their quality of life. With that being said, habilitation is a great resource, but as mentioned, there are many other components that will constitute a family's decision to continue with care. If the family is able to financially support the child well into their adult years, this will aid in preventing many of the misconceptions associated with like hiring individuals with disabilities. Families also have a negative perception of habilitation programs, such as concerns that their loved ones will be vulnerable to abuse, whether that's physical abuse, emotional, or mental, and also incompetent care providers providing services that may affect the family's decision to use habilitation programs. So providing the families with plans that can effectively assist them in caring for their loved ones should be taken into account. And something such as a family treatment guide can support them in problem solving, decision making, and goal setting, and self-awareness within the family. The table that is going to be shown shows many of the barriers that families have listed that affect their thoughts about transition programs and how to resolve those concerns. So just a few of them are just the misconceptions that professionals may have about families, thinking that parents may be uninvolved or either that they're overly involved. And some ways to help with that is just for the professionals to take more of a partner role versus an expert role. So partnering with the families, understanding their concerns, understanding what they want as a whole unit, and seeing where you can fit in as a team in helping with the child's progress. And also another would be just the lack of opportunities. So although there are transition programs out there, they're not many, and you have to think about the environment, you have to think about the communities that they're in. If it's a low economic community, then there may not be as many opportunities. So creating more opportunities in collaboration with families and schools would be beneficial.
Kira, firstly, I appreciate your explanation on the differences between empowerment and habilitation. Making that clarification is paramount because I, as well as many others, assumed that the terms were directly interchangeable. So to know that empowerment more so refers to the enfranchisement of a formerly marginalized individual or group, while habilitation refers to the development of more of their daily living skills is helpful because throughout our careers, these are terms that eventually we are probably going to encounter again. As far as the quality of life for those who receive habilitative services, I do agree that their quality of life is likely higher than those who receive the services of care programs, and that's because of the promotion of greater independence. I also agree that habilitator services would be much better suitable for neurotypical populations such as those listed, but I don't want to undermine the effectiveness for people who do have special needs. For example, I had a client in the past with mild autism who had very few interests, and his team of professionals, including myself and his parents, we were able to encourage him to try cooking a couple things at home. Like, for example, we taught him how to make a grilled cheese, and just cooking became something that he loved to do. And because of that, we were able to cultivate that and encourage him to actually enroll in cooking classes. And he liked those cooking classes so much that now he aspires to go to culinary school after he finishes high school. So I understand that while his case is only one among many, it shows that these programs could be just as effective for one with special needs as it would for their neurotypical counterparts, although it is admittedly less likely. And Megan, thank you for providing the literature regarding the quality of life for the families who care for individuals and how that quality of life affects the quality of the care that they receive. I feel as if through the debate of care and empowerment, we tend to focus solely on the one receiving those services, but we don't really take it into account the environment in which will affect the quality of those services. So I do appreciate how you brought that to the table. And I do agree that habilitation doesn't focus on those people around the individual, which, like I said, could lead to a lower quality of life as time progresses. But I do wonder if it's possible that the family's quality of life could be improved by the client receiving those habilitative services and are able to do more on their own, because that's less of a taxation against them. So once again, thank you both for your input in terms of quality of life. And now Kira will discuss the power of choice.
All right, thanks, Megan and Michael. While I agree that habilitation programs may not always take the family as a whole into account, I also think that some families, while they may have their loved one's best interest at heart, may not actually always know what is best for them or may be too worried about possible outcomes. It's definitely important to take family members' thoughts and recommendations into account because they do know the individual better than some random professional that is just coming in and meeting them for the first time. But they may overlook some important skills that their family member may be able to learn because they may be overprotective and fearful of their child getting hurt, which in turn limits the opportunities available to the person. Instead of simply not allowing their loved one to participate in certain activities, they should work closely with professionals to come up with modifications or accommodations that will allow their family members the same or similar opportunities as their neurotypical peers. One major way in which we can empower individuals with disabilities, as well as those without, and increase their autonomy and self-determination is through the power of choice. Giving people choices about what they want to do in their lives and how they want to do it is certainly a way to empower a person. If your power of choice is taken from you, you're most likely going to feel very disempowered and as though you have no control over your life, which happens a lot to individuals with disabilities in care provision. So an individual skill repertoire certainly needs to be taken into account when giving them choices to ensure that they can make informed decisions that will actually benefit them in the long run. It's likely that if you are able to make a choice about a skill you would like to learn, you'll most likely master that skill much faster than if someone else determines the skill that you'll be learning. It's also important that when an individual makes a choice about the way in which they want their life to progress, you support them in that choice and do everything you can to help them be successful. This first image illustrates that more than half of individuals with ASD in California want to work and are most likely quite capable of doing so. but only 17% of the individuals that responded feel knowledgeable enough about the resources available to them in order to pursue and be successful in employment opportunities. This is where a habilitation program would be helpful in teaching these individuals about what is available to them so that they may feel more comfortable in their choice to pursue some type of employment. This next image shows that only 16% of individuals with ASD in the UK are employed full-time, and only 10% of individuals that said they require extra employment support actually receive it. It certainly doesn't seem as though we as a society are doing everything that we can to empower those around us, namely those with disabilities, to live the highest quality lives that they can.
Thank you, Kira. And I can agree that we are not doing as much as we could and should in terms of giving this population the information and tools that they need that would aid them in finding and maintaining employment. This could be partially due to the underestimation of individuals with special needs, the focus of resources being more geared toward the ones who require them more, such as people that are under care services, or potentially other possible factors. And as far as giving individuals the power to choose, I appreciate how you mentioned that one skill set should be considered when deciding if an individual should be given the ability to choose for themselves, and if they are providing full support so they can gain that mastery. The challenge in that, however, is how we ascertain that the individual is ready to make those decisions on their
own. Thanks, Michael. Kira, I certainly share some of your thoughts regarding autonomy and self-determination. As a professional, there is a great deal of concern regarding liability and provision, and it is essential to be sure to assess whether or not the client can effectively make decisions for themselves. But what happens when the individual attempts to advocate for themselves and is met with opposition? Waymer and Ward found in a 1995 study that many of the observed initiations made by students with disabilities went ignored by staff members, making it impossible to assess the level of autonomy when the notion is set that the individuals aren't able to make proper decisions. There is a great deal of misconceptions regarding people with disabilities and their ability to gain employment. As mentioned before, habilitation programs do a great job with providing the tools to the individual, but the concerns with many families are regarding the outside world. How will the world respond to them? Will they be able to sustain themselves? Are they capable of forming lasting relationships and bonds? Those are the types of concerns that they have. It's important to understand that the child could possess the skills, but the misconceptions of the world still may present barriers for them. Many of those misconceptions revolve around like the cost of accommodation for the disability, through additional time invested in training them or even in supervising them. In a 2017 study conducted by Scott et al., as of 2016, only 11% of adults with ASD held a full-time job in the United States. And this is even with habilitation programs. So where's the discrepancy? In order to close the unemployment gap, there has to be some type of understanding of the impact of the influence of external factors on employing adults with ASD. This table here shows the highest percentage of the reasoning behind employing an individual with ASD is through contact from an agency. Excuse me. But this does not show the support once the individual has the job. How will those around them respond to them? How will they support them in ensuring that they keep their jobs? This isn't something that is spoken about. There are laws in place to help close the gap, but that does not assist in supporting that individual after that. This can affect their esteem and can prompt their families to step in and assist the individual. With that being said, those who are incapable to make decisions independently can appoint someone they trust to support them in making decisions. It is then when the families and clinicians have the responsibility to provide access to the care for the individual. The key to this is support. So if the individual is able to understand and conduct themselves in an appropriate manner, then they should be supported in making their own decisions.
Megan, you talked about how staff in care provision may ignore the choices of those in their care because they don't believe that they can effectively make those choices. I definitely see this as a problem within care provision. There should be a focus placed on empowering the individuals in care provision rather than just dismissing them and their wants and needs. In my work as a direct care professional, I've personally seen staff dismiss their clients' choices because they believe they aren't prepared enough to make the choices regarding their lives. This is not true. Even lower functioning individuals are able to make some sort of choice regarding how their lives should progress, even if it's something as simple as pointing to a clothing or food item that they want to use at that particular time. While I firmly believe that there are some great aspects to care facilities, having worked in one for the past several years, I have certainly heard about and have personally witnessed some things that would make families concerned about placing their loved one in a care provider if they were to find out about them. The fact that the company I work for has to teach a training course about abuse, neglect, and exploitation should tell you that those issues have obviously been a big enough problem in the care industry to warrant the training provided by my company and many others. An article by Marsland, Oakes, and White discusses these trainings. They seem to think that these trainings have more of an impact on responding to the abuse that has already occurred rather than preventing and protecting individuals from the onset of abuse. They also discussed how staff may miss the signs that an individual in their care may be at risk for abuse, but they recognize the signs but don't act because they're afraid of repercussions, and many won't report because they feel as though they don't have sufficient evidence to back up their claims. These are significant issues that need to be addressed and would most likely greatly increase people's views regarding care providers. I also feel as though it's important to discuss issues brought up in the 2018 article by Roberts et al. These issues have to do with individuals transitioning out of care. These issues include lack of knowledge of psychological services available to them, lack of knowledge regarding the importance of and how to set up doctor and dentist appointments, lack of knowledge about cooking, nutrition, budgeting, and finance, difficulty obtaining and maintaining employment, and not being able to deal with loneliness and depression that they may face upon exiting care. These issues all stem from never being taught how to do these things on their own and having their care providers there to aid them in the process or do everything for them. Because of this, they're going to need some sort of habilitation program in order to learn how to successfully navigate these obstacles anyway. So it's possible that they would have benefited more from being placed into a habilitation program in the first place rather than in a care provider.
Yeah, I share your sentiments on the concerns of care in residential facilities, Kira. There is a great debate about the level of care an individual with disabilities can and should access through the progression of their lives. And this refers to the long-term care received if they're in a residential setting or if they decide to continue to live with their parents into adulthood or if they live alone. But regarding care, it's important to remember that it's a team effort. So when the choice to continue with care is given, the community supporting that individual must take into account the level of provisions that will be given. Though there are a great deal of organizational support out there, we have to ask ourselves, what's the quality of that support? So we still have significantly low unemployment rates for individuals with ASD. I mean, college is still very daunting for them due to the lack of specialized accommodations. We have to look into where these loved ones are supported. That's important. The Achieving in Higher Education with Autism Developmental Disabilities program at Carnegie Mellon University in Pittsburgh models how to effectively support individuals with different disabilities in higher learning. And they do this by developing individualized strategies to help manage their college careers independently. If this is happening everywhere, then lessening the restraints of care is likely. Many families want their loved ones to feel supported within habilitation programs, and if not, continuing to assist in care is imminent.
Michael, you're muted.
Thank you. Like I was trying to say, thank you both. And Kira, I like how you mentioned your direct experience and witnessing clients' preferences not being considered. I do agree that at some level preference should be considered, even if it's something as small as, for example, what color shirt they want to wear or where they would like to eat their breakfast or what they would like to eat for breakfast. And I feel this is the case because the more choices one can provide for the client, the more likely it is that the services that they are receiving will be successful down the line. I also understand your sentiment about the fact that a client in care is in a very vulnerable position and could be subject to things such as abuse or neglect. And that's a scary reality that does exist in some cases. I don't want to undermine this concern at all, but because it is very serious, but I do believe that these trainings are more so in place simply to address that reality and not make it appear that it's something that is more likely to happen. It's always safe to assume that those trainings are necessary than to assume that they are not, because you can never just know what someone coming into the job already knows and what they don't. This is one of those things where it's best to have that all on the table before getting started, just to avoid potential situations down the line. And Megan, I can also understand your point that the quality of support available to individuals who are ready to explore their own ventures, such as college, is worth observing and questioning. For it's fact that employment rates for individuals with special needs is low. This could be due to ineffective support and sending them out on their own too soon, which could indeed lead them back into a care setting. But I do believe that this isn't the be all end all. Progress is not something that's always linear, and sometimes it does take a step back in order to take two steps forward. So, in other words, it's entirely possible that the necessary skills could be taught and an individual could transition back to a more habilitative setting, leading to that more independent life that we hope for them to have. So now I will field a few questions that we felt may come up during our presentation. The first being, what measures should be taken from a care perspective if an individual who is not ready to make their own decisions by transitioning age wants more of that autonomy? And to that, if that is the case, then this is something that should be discussed with the family. We should inform them of the individual's wishes as well as provide resources that could help promote that greater autonomy that they seek. If one isn't deemed ready by that transitioning age, that doesn't mean that learning stops. It doesn't mean that growth from there forward is impossible. Therefore, I do believe that through providing these resources and support for the family and individual, we can and should do all that we can to help them reach this level of independence they're looking for. And if they continuously are not ready after that, the next step forward would be based on the family's wants and their needs. The second question, we see that there are many intertwining concepts among care and empowerment. And could we list a more concise observation of how they overlap? Well, the most obvious overlap between care and empowerment lies in the fact that the main goal for both of them is to lay a foundation for creating the most successful life for the individual as possible. This, however, depends on the family's wants and needs as well as the client's ability. The two also overlap in that the acquisition of new skills is promoted and encouraged, although this is more so the case for services geared toward empowerment. Looking back earlier through this debate, I recall Kira talking about how in a care setting, it's more likely that you will see a client not perform these tasks or not even bother learning how to perform these tasks because they know that if they don't do it, someone else will do it for them. The third question, what provisions are set in place for families that want to discontinue services but is not beneficial for the client? As per the BACB Professional and Ethical Compliance Code, their services should not just be abruptly ended, and resources should be provided in order for the family to be able to continue to search for the resources that they and the client may need. It also states in the compliance code that services shouldn't be ended until a series of agreed upon criteria has been met. But of course, if it's specifically requested by the family to or the client to end services, then that's just how that has to be. And then other reasons that services could be terminated could be services showing no improvement for the client over time, or it's shown that these services are actually harmful to the client. But as long as services are not abruptly ended, measures should and would hopefully be taken to ensure some future benefit to the client. And final question, would providing habilitation or care services be more appropriate? And to that, I say this really falls on the wants and needs of the client. We can never outright determine which overall strategy is better because each individual's circumstances are different. There are some who are capable of making their own decisions but lack the knowledge of how to provide their own care. There are some who have the same capability of making their own decisions but simply lack the self-determination to do so. And on the other side of things, there are some who lack the ability to care for themselves and would therefore be more benefited by care services. So all in all, there are pros and cons to both habilitation and care, which have been shown throughout this debate. And each of them should be carefully considered on a case-by-case basis, depending on what the client needs and what they are capable of doing on their own. So this has been our debate on care versus habilitation. Thank you very much for listening and have a great rest of your day or night.